please join me in the Pledge of Allegiance. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Item number 2, amendments to the agenda. Is there any amendments or changes? Otherwise, they will stand as distributed. Item 3, approve the minutes of the February 4th, 2020 County Board meeting. We've had those distributed in our packets. Are there any changes, additions, deletions?
I'll move that we adopt the minutes as they were presented.
Motion and a second. Any further discussion? All in favor, say aye. Aye. Number 4, recognition of interested citizens. This is an opportunity to speak on any item that is not on the agenda for 5 minutes, and I see Leslie Vermillion, our very own. Welcome. Good morning.
Morning, Mr. Chairman. Yeah, Leslie Vermillion, the County Administrator. And I have the honor of giving a 5-year tenure award to one of our county commissioners this morning. So if Commissioner Beard could come forward.
Is it 5 years already?
Does it seem longer?
5 years.
So everybody for a 5-year recognition for tenure at Scott County receives this award, including the county commissioners. And so this one states that in recognition of dedicated service to the County of Scott, January 6, 2015 to January 6, 2020, it is an honor for the chairman of the Scott County Board of Commissioners to present the Certificate of Merit and Appreciation to Michael Beard. So congratulations.
Thank you. Thank you very much.
Oh, you got it. Yeah, I mean, I figured there's going to be a speech for this guy, right?
This is the first time someone's ever.
Yeah, right. We're on the schedule.
How much is my 5 minutes has she used up? Oh, no, seriously, it's, running for county board 5 years ago, I thought, well, what a great way to kind of cap off a career of public service, elected public service. It's been more rewarding than I even imagined. So thank you, Dave Menden, for talking me into doing this, and thank you to Mrs. Beard for allowing me to serve, and to 60% of the voters who thought it was a good idea. Thank you very much.
All right, item number 5, we are going to receive information on Scott County delivers emergency preparedness and surprise snowfalls. I added that part on there.
Good morning,
take it away.
Good morning, Mr. Chairman, Commissioners. We are here to talk about emergency preparedness and emergency management this morning. This group was last here in 2018, and at that time, there was quite a lot of information presented around the county's capacities. And there were also some very good questions asked from the county commissioners about prioritizing and progress and kind of where to get our most bang for our buck. And so we're going to talk about all those things and try to circle back to those questions that you had at that time. I did want to point out a couple of other things. There's not good community indices for emergency management. It's a scale of capacities, and Scott and many of the other people here are going to talk about that this morning. But one solid piece of data we do have comes from our resident survey, and in 2019, 71% of residents rated our disaster preparedness as good or excellent, and that is the single highest rating that has ever occurred since the question was added in 2011. And so there's some reflection in our community that there's progress and that is viewed positively. The last thing I just wanted to say is that emergency management is factored significantly in our new strategic plan, both in the values that we're going to prepare and respond to emergencies, and also there's a couple of specific tactics around training, building resiliency among our residents and our communities, and I think our panel is going to speak to some of those pieces of the work that's coming in the future as well. Morning. We do have a couple folks that are going to come in as a result of the tricky roads this morning, but I'm going to ask folks to introduce themselves, and then we'll get started right away with questions.
Brad Davis.
Suzanne Artson.
Jennifer Schultz.
Kara Madsen.
Kate Sodlaczyk. Lisa Brodsky.
Scott Haas.
Thank you. All right. Suzanne, do you want to start?
Sure.
Thank you.
So good morning.
Good morning.
Thanks for putting all the information together. I'm going to refer us to page 5. as we look at the grid, I'm curious, what would you identify sort of top one or two priorities? Where might we have sort of the biggest impact in terms of just trying to continue to move forward in this area?
Thank you for the question. I think right now, as we look at all of the 32 core capability areas and where we're strong and where we're lacking, the grid, just to explain the grid for those of you who are putting a fresh set of eyes on it, the green areas are areas we're meeting capacity. We, through our self-rating, think we're doing okay on. And dark red areas are areas that we're really doing poorly on. And the bolded areas are areas where we've been making an improvement over the last year and a half. As we look at where our biggest bang for the buck comes in, we really focus on, at least in my opinion, we focus on how we make our own staff prepared and get them up to the base standard. I think that's a fundamental step we need to take, and we're taking action to get there. But if we don't have our staff up to a basic standard, none of this means anything. If we can't perform when some kind of a emergency or disaster occurs, whether that be a tornado, a flood, a pandemic, a cyber incident, if we can't perform, none of this matters. We're going to fail across the board. So my opinion is the priority of all of the areas is to really focus on getting our training level up just to a basic standard so we can actually start addressing some of these core capability gaps.
Scott, along with that, on page 23, I think that kind of shows where we're at from a training perspective with NIMS compliance, if I'm reading that correctly. And so we've kind of stayed even, gone up maybe slightly with our training. What would be the ideal, or where would you like to see that for staff being trained, and what are you trying to get to, and how do you see, so a few questions. How do you see that happening, and kind of what's your goal for a timeline for us to be where we would need to be from a training perspective for staff?
Sure. So the, excuse me, the national standard is any employee of government who could be involved in a response should have at least the IS 100, 200, and 700 courses and certifications at that level. If you look at the chart, that's measuring what we currently have records for. So over the course of the last year, through a number of discussions with county administration, with employee relations, we've established a few steps that we're taking. The first being delivering that training to the senior leadership team. That was completed at the end of last year. I believe December was the completion of the last of those classes. So we got our group of senior leaders up to the standard where they've had the opportunity to go to the training. The next steps moving forward are to look at how we then bring the bottom up as well. We've had discussions with the employee relations director over how we would implement this moving forward. And our plan is that the IS 100 and 700 courses, which are actually the entry-level courses compared to the 200 course, which is more advanced. I don't know why FEMA does that, but it's FEMA. Those classes are going to be taught every month in a classroom setting. So any new employee coming in is going to have the ability and the expectation to go through the IS 100 and 700 courses taught by our staff in a classroom setting with the expectation that they then get the IS 200 course done using the online independent study action. So this is an area I would expect over the next 2 years we're going to see a very dramatic shift in, and I would expect us to be very close to 700 employees in the course of 2 years that are trained to that minimum standard.
Scott, for existing staff, like you spoke to the new staff coming in, but what's your request or what's your recommendation for supervisors with regard to existing staff?
Lori Huss is actually going to be sending an email out shortly, when exactly that is, but detailing a plan to bring all staff up to that standard and what the plan is. So existing staff will have the ability to go to those in-classroom classes if they wish to do so. Otherwise, they'll be able to take the online courses and get compliant that way as well. But we're putting, I believe, end of 2021 as an expectation date for that.
Thank you.
I had a couple of questions on page 17 on the volunteers.
it looks like in 2019, there was a pretty significant spike in the number of volunteers. I'm just wondering what you're attributing that success to.
So I can address that. The volunteers, recently we we purchased a new program here in Scott County for our volunteers. So we have been working to update all our records to make sure that the volunteers that we currently have in the system are still available. I have been tasked with bringing on more volunteers for some upcoming drills that we have going this year and the following year. So I've been really reaching out to the community, and then in fact, talking to the volunteers we currently have. They may be a library volunteer, but asking them if they'd be interested in volunteering for emergency management cases. So we're trying to develop a little bit stronger team that we can really reach out to for emergency management purposes, although we would be able to reach out to our entire volunteer corps.
And the chart shows a target for anthrax, and I'm wondering, is there targets for other types of public health emergencies other than anthrax?
So I see Alexa coming right now, but just on the previous question, in 2018, we actually changed our volunteer process, and that actually made quite a difference. Previously, we had a separate volunteer database for our Medical Reserve Corps and the county's system, so our volunteers actually had to apply for the Medical Reserve Corps and the county, and that seemed to be holding up the process, and it was a bit of a barrier. Following the floods, we met and realized we had some duplications of efforts, and Kara had this great system that we didn't really need to have two systems, and we merged the system into one, and it's been a lot more efficient. I think tracking is also very more efficient, and it's a lot easier for people to become a volunteer. So I think that also had something to do with the increase. We use anthrax as the worst case scenario because we need to ramp up within 48 hours, and it's really an all hands on deck. We need an awful lot of people that we would run probably 24 hours, like 2 12-hours or 3 8-hour shifts over the period of 2 weeks. So that's our worst case scenario. So if we figure if we have the 348, we could do anthrax, we could probably do just about anything.
Kara, can you speak a little bit to like, for lack of a better word, but like skill sets and volunteers, or are these just actual people, or do you match them for certain emergencies, or what does that process look like?
So in our new system, we're able to distinguish between our volunteers. So a lot of our MRC volunteers that we brought on originally, we now have in the system, we know who are doctors, who are dentists, who are veterinarians, things like that. We have in the emergency management area, we have like a sheriff reserves, they're always top there. But we're able to get a little more detail now of what our volunteers are capable of. So if we had an example of something with anthrax, I mean, we could reach out to specifically our doctors in our database and tap them first before we would reach out to maybe somebody else that would do, you know, signing people in as they're getting their anthrax shot, something like that.
Are there specific training, the volunteers aren't doing the NIMS training, but is there specialized training around sort of preparing volunteers for?
We've talked about that, and we hope to down the road. Our specialty volunteers, so our sheriff reserves, our SAFECOM volunteers, they do receive, if I'm not mistaken, the NIMS training. So we're looking at that as we go down the road. We've got some key volunteers that really helped out in our Jordan flood that I think if they haven't gotten NIMS, they're kind of on the radar that we should get them NIMS certified. So.
And before, all of the MRC volunteers had like a core suggested trainings, and those included the NIMS trainings, and then they also included a volunteer primer for points of dispensing that's free through the Minnesota, through the U of M, and then they could, once in the U of M system, there was a lot of additional trainings that they could, so we did keep track of some trainings. So
Can we just take a pause for a second? Do we know where the music is?
Soundtrack?
it is not me. I know you think it came with me.
It started when Alexa walked in the room. It's kind of calming.
It is kind of calming, but I could see you were all a little distracted, so.
It was me, I guess. Not only was I late, I brought beautiful music.
All right, thank you. Sorry, that's okay. All right. I wonder, just using the Jordan the Jordan flood and that experience, as long as we're talking about volunteers, if you could just talk about, in hindsight, were there places where, were there lessons learned through the Jordan flood experience that changed how we might use volunteers going forward?
Take a shot at this one to start it off. I would say absolutely. So prior to the flood, we, with emergency management, had partnered with an organization that made lots of promises about what they could deliver for pet sheltering. We actually exercised them as a part of our full-scale exercise about a year prior to that. Learned that they had a few gaps, but they had a really good group of people, knew how to take care of pets. They were our go-to people. We had worked with them every year over the last decade, confirming that they were available. They actually had equipment that was stored at our regional training center. It was staged there, so we had a very positive relationship with them. When the flood happened, we called them to activate them, as by federal law, anytime that we do any kind of an evacuation of people, we also have to, and sheltering of people, we have to open a mirror pet shelter under the Federal Pets Act. And excuse my phone, it's vibrating like crazy. So we reached out to this organization, tried to activate them in accordance with the activation procedure. We practiced with them, worked with them, and their answer to us was, we just changed our insurance coverage. We can't deploy unless there's a declared state or federally declared disaster. Well, that process, as the board knows, and as those of you who watch the process, that can come weeks after an actual initial event occurs. So their insurance coverage won't allow them to come out here. There's really one organization that does it well. Anoka County has a team that we use as a secondary basis to activate, and they started coming down, but ultimately we use spontaneous volunteers in that situation. So I think the biggest lesson learned from a volunteer standpoint is that this is a gap. We expected to have this nonprofit partner come in and fill this gap. They failed to perform, and as a result, now we have to fill that role ourselves. So this is an area that we're working at, filling the gap and training a group of volunteers to be able to perform that service. So it would be nice to partner with an agency that would do it, but at the end of the day, we're legally obligated to do it. So when another organization failed to do that, it became our problem, in essence.
How about other lessons learned around the use of volunteers in the Jordan flood?
In regards to the volunteers, I think a lesson learned was just kind of the, I guess the best way to put it is being prepared. I mean, we were able to call out our volunteers right away. That was something with our new system. It's a web-based system, so when I got a call that morning right away, I was able to go to my personal computer, get onto the web, and put out an email request immediately, rather than racing into the office having to use my business computer. So that did help a lot. Just little things. We didn't have forms ready. You know, for a pet shelter, we were writing down the animals' names on a piece of paper and who their owner was and who their phone number was. So since then, we've found forms that we can utilize in case of a pet shelter. Just, you know, I think a lot of it was kind of paperwork that we probably needed for FEMA. I can't speak to everything that we needed for FEMA, but just some of those records that we didn't have readily available, what we were able to figure out. So I think we've got emergency management now has a couple tubs ready to go in case of that emergency, and that we've got this information. We were literally working off of tablets and, you know, a pen and paper saying, okay, this was our volunteer that came in from such and such a time, and this was, you know, the pet and the pet's name and that sort. So some of those little things, thank goodness they were little things, but that we now know moving forward, should this happen, this is what we need to do.
How about for public health and environmental services in the coordination? Were there lessons learned from Jordan through, because there's a lot of references in the packet to some concern about silos, and I'm just wondering what, in terms of how all of you work together, what went well or what were the lessons learned?
I think from the public health perspective, one thing I mentioned earlier is that duplication of efforts for our volunteer management system. So since that time, we've merged them together. And then some other little things, the communication, how to get a hold of public health on the weekend. A call was made to someone who wasn't a 24/7 employee. So just sharing of those plans. If there is a public health emergency, here's who's 24/7 and here's how to activate public health. And those lines of communication. Anything on the,
For environmental health, I think the communication goes pretty well with Scott and Megan Tasca, the water resources engineer, and then Joe Wida for mobilizing. So we're not directly by the damage of the flood, but leading up to the flood, staying in communication with each other on the water level, when things are going to be, when the flood is going to occur.
Okay.
Were there activities or pieces of that response that you think went really well, like went exactly how you had hoped, that you would want to make sure are sort of in place to be replicated should another event happen?
I think in any kind of a crisis, nothing is perfect. So if I would say that this was a perfect response, I'd be full of myself. However, I think there's a lot of lessons learned as far as what really worked out well. Valley Green Trailer Park, where a lot of the concern was, is an area that has flooded in the past. It flooded back in 2014 as the most recent event, and as a result, because it was a chronic flooding or chronic area prone to flooding, there was some experience that was residing with the city. So when things did get to the point where that creek level was rising very quickly, the city enacted its plan, which was to activate buses from the school. They already had a pre-established shelter at the high school, and that part worked really well. I got a call from the police chief. I was in our EOC at the time. I'd sent Ron Holbeck, my deputy director, out to the scene to get more situation intel. But I stayed in the EOC and got phone calls as to what was going on and what they needed. One of the elements that hadn't been done in Scott County before that worked out well was issuing a wireless emergency alert. So we were able to send an alert out to cell phones in the area advising them where the shelter was. And that had kind of dual benefits. One, it alerted the people who were impacted, but it also prompted some spontaneous volunteers to show up at the school location with blankets, toys, drinks, food, all the stuff that, you know, people, good people come out and try and help their neighbors. That totally happened at the high school. So that part, and this is largely on to the credit of the city of Jordan. They've been through this, they activated that plan. They looked to us as a way to supplement the resources. So we had our volunteers, what worked out really well and was unplanned is our reserve unit was actually doing training at the Regional Training Center that night. So it was a phone call to our sergeant who was over the reserve unit saying, we need to activate you, and it was a matter of minutes. By the time the first busload arrived at the high school, we had a number of our volunteers already there. We had our temporary sheltering kit where we register people who've been displaced already there, and the sheltering element really worked well. And the last thing I think that worked well was prior to this, we had been meeting with the American Red Cross over the course of about 2 months' time, and we really pegged that we were very concerned about the Jordan area. So they had looked at that area. They knew that there was a potential that this was going to be a large potential evacuation area or sheltering operation, and they were ready for that phone call. So our role in that kind of a situation is to provide the sheltering. However, in this case, we've got a good partner with the Red Cross that we were able to call them. We provided temporary sheltering for about 5 to 6 hours, at which time the Red Cross had their permanent shelter in place, and we could then move all of those who wish to go on to the permanent shelter, as they call it, a short-term shelter. So that part really worked well. Even from the elements of the high school is located right next to the, I think it's the CERC, which is the American Red Cross, so people just had to walk from one location to the other. And that part really worked well. From the displaced people, they were very happy with the information they were getting. The police chief was providing daily briefings to them, so they knew, you know, what to expect, what actions we were trying to take to mitigate the problem, and they were being informed. They had the ability to go out and see their pets, and we were providing transportation for that. So that part really worked well. The sheltering operation worked well, and I think experience taught us some lessons from 14 and prior years.
I think one other thing that worked well were the mitigation strategies that emergency management did afterwards. They went around in the trailer park and distributed information and supplies to help clean up water and water damage to prevent any kind of mold. And we got very little calls from that area, so I'm going to assume that those prevention strategies worked. If you look on page 22, We had a lot of precipitation in 2019, and one of those effects of that is we had, from a public health nuisance perspective, is we had 4 times as many mold calls. And we attribute that directly to the amount of precipitation that happened in Scott County. So it could have been a lot worse. So once, even after the flooding went away, a lot of these homes could have had quite a bit of mold, problematic mold in their homes. So I feel that those mitigation strategies that emergency management did were fairly effective, and they distributed them in different languages, so it was helpful.
It's clear how important volunteers are in emergency management. On page 19, there's a graph on the economic impact of these volunteers. And I'm just wondering kind of what the formula looks like to put this graph together. I imagine you're counting the number of hours these volunteers are provided by some type of hourly rate. Is it that FEMA establishes, or just tell me a little bit more about how these dollar amounts got calculated?
So that dollar amount comes from independent sector, which gives out a nationwide dollar amount per volunteers, and then it also gives out a state amount. So every year that number comes out in April, and that is the number that we used for that. So we just took it, I think it was, I didn't do the exact calculation, it was like $24.18 or something per hour for volunteer services. So that kind of covers the full spectrum, but that's where that number came from.
And that's an amount that's equal, or it's the same for both the medical reserve and SAFECOM? It's kind of across the board?
Correct, it's an across the board.
And I know that SAFECOM covers a variety of things. It's mentioned weather spotting, call centers, sandbag, evacuations. In 2019, what was kind of the spike in those hours from the SAFECOM group?
A lot of this came down to pet sheltering operation. So we ran a pet shelter for 5 or 6 days, and that's an area that is staffed 24/7. When we take people's pets into our custody and open a shelter, we're responsible for them. So we have to provide staffing 24/7 to make sure that that works. So we had a phenomenal group of volunteers. I can't speak enough to the quality of people. People were taking days off work so that they could work, very long shifts to make sure that these people's pets were taken care of. So we had, for a number of days, 24/7 operations of volunteers keeping that pet shelter going. That was a big part of it.
Can we go back to page 5 for a minute? So, so Scott and Lisa, when we were here last in 2018, one of the questions from the commissioners at that time was, gee, 32 capabilities is a lot, can't possibly focus on all these things. So I think there's about 10 red boxes. Certainly we want the green boxes to stay green, but there's about 10 various shades of red boxes. When you look at that as directors of our emergency response teams, what's your recommendation around priority?
Want to start?
I could start. So these are the emergency management ones, and the ones on page 6 are the ones that apply to public health.
Thanks, Lisa.
I think, and I'll let Alexa also respond, related to our upcoming exercise, but I think in my perspective, I think that community resilience and community preparedness is critical. We have 141,000 people in our county. If something happens during high season where we have Valley Fair and we're a destination county, so we may be responding to 200,000 people or more. I think we have a small number of staff. We have only a limited capability, and we want people to be able to respond to their own emergencies and be able to recover. So we only have to help those that really absolutely need it. So I think increasing that community resiliency, the community capacity to respond to an emergency. If you look at page 3, we had these 10 threats listed, and these don't even include the public health emergencies. Since we met last, every single one of them but one has happened in our area. And now we're in infectious disease, possible coronavirus. We have hepatitis A outbreak. We have flu outbreak still going on still. We have low hospital bed capacity. So we're at a level where we are under normal response. So what happens that's going to tip the scale? You know, if we have a widespread coronavirus outbreak, it's going to be an issue. So we really need to focus a lot of our work on both sides of that coin, our capabilities, but as well as the community's ability to help themselves in a time of a disaster or an emergency. You wanna add?
Yeah. So what does that look like? So what would be the priorities to do that, Lisa, to really get out in the community and help prepare them to help themselves?
And what would tell you that that happened, right? That the community is in fact now more prepared?
I'll answer the second question first, because we currently don't have a question related to preparedness on the resident survey or any other survey. We're actually measuring that, and what does that mean? Does that mean that they have a to-go kit in their home, or they know what to do during the tornado? We're not really quite sure what that metric is. But Alexa has done quite a bit of work already on community preparedness, if you want to talk about some of your daycare work and faith-based.
Yeah, I think there's so many scenarios when we look at, on page 3, the top threats, and then you add the public health ones in there. There's so much to be prepared for. It's really difficult to find a metric. So I think having an understanding that there needs to be some level of preparedness is kind of the start in understanding what emergency preparedness is and what that looks like. So we reached out to a vulnerable population. We used our child care providers and our foster care providers because we knew the reach of that. So we started with teaching about emergency preparedness to child care providers. DHS had come down and said that they needed an emergency preparedness plan, but not given a lot of direction and coordination to the timeline for this plan. So we offered a class and taught that class to our child care providers. And then the following year, when we were working with licensing, we had done a survey asking them what do they want to know more about. They really wanted to know more about infectious diseases, and so we reached out to them to teach them about infectious diseases, the awareness, the prevention, and the control of them, and then really teaching them about what emergency management's role in public health role is that. So why do you report a disease? Why do we have reportable diseases? Why does public health call you back when you have a pertussis outbreak? And trying to help them connect the dots so they kind of see the full circle. So I think a lot of times we tell people to make a kit, but we don't kind of fill the whole circle, and I think that's what preparedness looks like to me, is having a better understanding of the whole way around.
So you've, I think it's great that you've targeted those areas. What would be additional community groups or folks in the community that you would see targeting next to keep that, to keep training and helping them be more prepared? Do you have some of those ideas?
So my next group that I'd like to see prepared and hope or kind of target is I want to kind of build on this so that we don't lose it, so that we don't just train the group and then move them on. So with the child care providers, then we quickly tied in foster care providers, which was at the request of licensing, saying they could use these same things. And we knew that now child care was talking to their families about it, but the families didn't have that education. So now we're looking at targeting those families. And I think targeting not only vulnerable populations, because those are the ones who will need so much help, but populations that can continue to spread our message so that the message doesn't stop with me, so that when we give the education, they take it one step farther and they share it with those. And that's why child care providers were so important, is we provided them a kit to talk to their kids about it, and then we provided them information to bridge that gap with families, and now giving the families the tools to take it, the next step. So I think there's lots of people we could do that through, educators,
So just to add in a few things as well, some of the areas that we've touched upon are getting out into the faith-based community as well.
Yep.
I know Alexa led I believe it was a 4-part series, or
Yep.
maybe more on preparedness that we were involved in teaching active shooter response. That actually flipped off of one of the participants in that then made a request, and I actually came in and did usher training for one of the churches that was involved, and over the course of 3 different sessions taught their ushers and their greeters things like basic first aid, how to use their resources, proper notification of 911, how that really works, and then going through some scenarios with them as far as what an evacuation of their facility looked like, how to respond to an active shooter, and actually trained at that level. Another area that I think Alexa's worked on as well as us is trying to hit kids. If you train kids, it's remarkable how resilient you build a society. So we've been focusing on teaching scouts. We've had Webelos, which was really crazy, in the EOC doing first aid. We had some brownies. Some brownies. It was pretty remarkable. The leader got wrapped up like to the point of being a zombie as we were teaching first aid. But when you catch a kid and you teach them about preparedness, you teach them those core lessons about why it's important, they hold that and they grow up with those skill sets. I think it's especially important to hit that group because participation in things like scouting is down across the board. Participation in things like camping and a lot of the more traditionally resilient things. I mean, those, as a society, we're shifting away from that. We don't have people who go camping on a regular basis. And as a result, when we talk about being resilient, as I really talk, if you can go camping for a week, you're ready to go. If you can plan and work to maintain your food, cook your meals, live in a tent, you're in pretty good shape if a disaster hits you. If you've never set foot in a tent, if you've never planned on how you're going to cook your food for a week, you're going to be in trouble. And that's something that we have to kind of shift. As society changes, we have to understand that some of those things that hardened our society in the past is shifting, and we have to be able to address and try and fill in those gaps.
I think with that, when you can teach a child these things and what we talked about in our classes, you can take away some of the fear. So we know these things aren't going to happen. We've seen them happen. But if you can help reduce that fear, the public health person says in me that it's like better for them overall. But reducing that fear makes it easier on the family, makes it easier on the child. It's really what a resilient community is. And so when they hear a fire alarm or they hear a whistle, they know what to do. And when a kid is in routine, they're happy. It's when they're scared that it's difficult. So,
just one quick story on that as well. So I forget the state that this occurred, but there was a boy who learned in school tornado sirens or outdoor warning sirens go off. You get everyone down in the basement and shelter. He was at home playing on his whatever game machine he was on. Sirens went off. He went to Mom. Mom, we got to go downstairs. The sirens are going off. Mom was like, it's fine. It's blue out. The sky looks great. Not a problem. Sirens kept going off. Mom, we got to go downstairs. The sirens are still going off. So Mom begrudgingly grabbed her kids, went down in the basement. Within 30 seconds, an F4 tornado went over their house. And they were fine. They walked out and they were fine. Why? Because that kid got taught in school, taught in the community. When sirens go off, you take action. As adults, we've been there, we've done it. You know, we are stupid and run out with our phones to see if we can record it and get on YouTube. Kids get these messages and they grow with them. And that's why it's so important to hit that target audience. We really build resiliency if we build strong kids.
I also think there's a lot more work we need to do with the faith-based community. I think that there's a segment of the population that may not trust the government. So even if we open up a large mass dispensing site, some people aren't going to come because of fear for other reasons. And I think by engaging the faith-based entities especially in a widespread emergency or disaster, there's a lot of fear already, and they may not trust the government, but they do trust their faith-based community. They trust their clergy, and by engaging them in part of the response, it will also alleviate some of the pressure off of us, and we will hopefully attract or serve those populations that may not come to a government-led response.
So getting back to the chart, I absolutely support community resiliency. I think that's an area we're all passionate about, and we see the benefit and see the impact of that. I also see a few other areas that we really need to improve as a county. Cybersecurity is an area that we need to improve on. Our fatalities management services. If we have a mass fatality incident in this state, anywhere in the state, there are very few people who truly understand how to process that scene, how to deal with people. There's the medical examiner and their job in doing the forensics of what happened, but there's also a component of how do you support the victims? How do you support the families of the victims? There are very few people in this state that have that capability. If it happens here, we're going to reach out to partners and try and make that work. but I'm not confident in our capability to be successful in that area. No one in the state has experience doing it, and it's one of those things that's a, very infrequent but high-risk event. You have to do it correctly, and especially in an area like Scott County where we have River South and we bring in 35,000 people out to the Renaissance Festival in Mystic and Canterbury. The possibility of something bad happening in this area is exceptionally high compared to most of the metro, and we have to be responsible for that. Another area that I think we need to improve, and we're making small steps in, is mass care. We have limited ambulance capacity within this area, and I think that's an area we have to continue to improve our first responder base on. I'm sure you've all seen where there's an accident and it takes a while for the first ambulance to get there. The second one may be 10 minutes behind. If we actually have a mass casualty incident, getting the number of ambulances that we would need to be able to process that scene and get people transported to definitive care it's going to be a challenge. And that means that we have to establish some stability and stabilizing capacity prior to the arrival of the emergency medical services.
So Scott, on both of those, fatality management as well as the mass care services that you talked about, what's it going to take to improve those areas, and what resources are really required, and what are the next steps to make progress in those critical areas that you've identified?
So in mass care, we're actually making some steps on that now. We're partnered with Shakopee, Mdewakanton, and Sioux community and our fire departments and police departments, and we've been working through delivering a standardized trauma care curriculum, and that would be passed out to all police and fire countywide. We're also using some grant dollars to acquire some really mass casualty trauma kits that would be used for mass shootings, mass stabbings, those types of situations, and we are going to have those staged in police cars and fire trucks around the county that will be supplementing with this training.
How about on the fatality management, because that's where you kind of really identify that across the state, it isn't really occurring very well. So what as a state or as a county even do we need to do to move the dial to be prepared for that?
In the emergency management world, we've been really trying to get a grasp on what this looks like. My personal belief is that we create a set of statewide teams that actually develop this skill set. I know a lot of the county's public healths have tried to work through some of the elements of it, and Hennepin has a pretty good system. But as soon as you get out, especially once you get out state, there's really nobody who's got that skill set. It's a very limited group. So if we're going to open a FAC,
Family Assistance Center.
Thank you, Alexa. So if we're going to open a family assistance center, understand that we're going to run 2 operational periods a day, so 2 shifts a day, and this is a place where victims come and they work with medical examiner, they work with human services to be able to get resources, they work with DMV, they work with, in some cases, the FBI or victim services. This is where they get the resources from. To be able to organize and run that and to have staff to be able to do it over 2 shifts per day and run that for a period of 7 to 10 days, we just don't have the capacity to do that. We don't have the number of staff to do it ourselves as a county, even if we had all the training time in the world and we could just not do our jobs for 2 weeks. We don't have the people to do that. So that's why I think a regional or statewide team is the right way to go, and that's I think where we've on emergency management been trying to work with some of our partners to see what that really looks like, and then get it funded, more importantly.
Is that a model that other surrounding states have used, or are there other models to draw from?
Most states use the Red Cross. So if there's let's say there's a plane crash that occurs, if the NTSB is the authority over whatever the transportation accident is, they have a contract in place with the Red Cross to deliver that service. They are in charge. Where we get into the mix is if it's not a plane, train, or automobile crash that's really big, and the NTSB doesn't come in, and it's not something that's declared an act of terrorism, that's on us. So that's why this is something that people haven't historically put a lot of resources into, because, oh, it's a plane crash, NTSB comes in and they have their contract with the Red Cross and they deal with that. I've actually gone to a couple classes with the Red Cross trying to understand more, but it's still, it's a really big resource to be able to staff that and to be able to provide the resources and keep people trained. I mean, we all have turnover, we all have lives that go on, and keeping a team that's very effective at that and ready to go at a moment's notice it's very challenging.
There are lots of incident management team models within the state that work really well. So there are incident management teams that will come assist you in your EOC. There are DMORT, which has to do with disaster mortality team. So there are models of response teams that are used really well and effectively in the state and across the nation. So.
Do you have any large-scale exercises or tabletop exercises coming up to test some of these gaps?
Want to talk about yours first?
Are you sure yours plays right into that? I'll go first and then you can go next. So we do have a very large, what's called a full-scale exercise. So on the scale of exercise, that's the highest level of exercising, which means boots on the ground for all positions. You're not simulating anything. You're acting it out as it was a real event. And so on June 17th, we'll have a mass dispensing site, and that's with our partners at Shepherd of the Lake Church. And we will be dispensing medication in an anthrax scenario. So we will have, our hope is 500 plus volunteers walking through, receiving their medications, and we will have the whole point of dispensing or pod site staffed. And each person starting tomorrow, there's a series of 30 trainings to train about 100 people to staff this pod. It's really important to note that we have put it at our lowest possible dispensing. So when you think, oh, 100 people, right, that's not what we would need in a real emergency. But our hope is to get a better understanding of all the processes and then how it works for the clients that walk through. We're working a lot with our data, our health data planner to collect some really important qualitative data. Or quantitative data, because we don't get a lot of these opportunities for process improvement. So we need all hands on deck, and we hope that you guys are all there to come and watch, observe, or be part of the day. I can give you a job. Trust me, I've got them. So, yeah.
And then the following.
Question on that.
Of course.
That's a full-scale exercise, so I'm wondering if this on page 10 is a typo. Under next steps, but the third bullet down, it talks about senior leadership going through the NIMS training, and that there'll be a full-scale exercise scheduled for 2027.
That is a typo. I don't know how that happened. So, I wish it was 2027. Give me a lot more planning time. 2021 is correct.
No,
What?
2020.
That's emergency management.
Oh, yours,
So-
sorry.
Yep, so this year, 2020, Alexis got her full-scale exercise. 2021, apparently my wings gang get some wings on them. In 2021, we're doing full-scale exercise in emergency management planning, and that is for an active shooter hostile event scenario occurring at an entertainment venue within Scott County. So with that, we'll be going through and simulating a complex attack type scenario that occurs at one of our entertainment venues, which will test initially the law enforcement perspective of containment and response, but then integrate the fire department's EMS. And really one of the unique things that we're trying to do with this is integrate our private sector partners. So the reason why we're partnering up with one of our entertainment venues is they are our strong partner when something happens. We bring, we bring all these people in and go to these events, and there's EMTs that work at these different amusement parks or Canterbury or Mystic. But in the past, a lot of times, fire comes in and police go in and they go right past those people. They know the local facility. They have the medical training. So we're really focusing on incorporating them within this exercise as well.
Mr. Chair. Scott, that was an important point. Would you hit it again? Involving the privates, is that what you?
Absolutely. So we're really focused on evolving the private sector within our exercise, because they are the first responder in any of these events. And I think Alexa alluded to it a little bit. When we have these full-scale exercises, people pay attention to the exercise itself, the hour and a half, the 2 hours of the exercise. But when we follow an exercise plan, what we're looking at is we look at where we have gaps. We identify gaps, and then we identify a training plan to fill those gaps. We implement trainings, just like I talked about, we're implementing the mass care training for police and fire. We've actually incorporated this year, when we had our ICS 300 course that we offered, we had Canterbury Park and Mystic Lake security staff that were in that incident command course with us. So we're really reaching out and trying to do this. So if you look at the hour and a half is exciting, but there's months and years worth of work that go to actually building capacity so that by the time you get to this full scale, people understand the role that they perform, and they should be able to perform that successfully.
This is really, for us, the cumulative of all of public health emergency preparedness planning money since 9/11. They have said, now you have had this time, now show us what you did with all your planning. And so for us, this is really important. It's not just us, but it's every CHB that receives public health emergency preparedness funding in the state will be operating on that day. So this is a big day for public health and preparedness money. And then we'll kind of close that book and keep those updated, but we'll really shift our focus to highly infectious, contagious diseases after that. But also, I just wanted to touch quickly, as we were talking about family assistance centers, and Jennifer, we hope in the 2021 exercise, public health hopes to exercise a component of our family assistance center, because that falls in our area of service. And so we've worked with Scott. He knows that we want to do that, and we've had those initial conversations and processes of how we might exercise that. And so.
Can I ask, as you think about community resilience and resiliency for individual residents, where does scale fall in that? There was a couple of references in the narrative, but is there a vision for how scale would partner with us as a successful entity?
So, not necessarily from the reaching down to the individual citizens level, but when we look at reaching out to government across the county, that's an area where I'm very interested in trying to integrate into scale. So a good example is, we have disasters. When a disaster happens, everybody gets split up. FEMA will work directly with the townships now and kind of go around us at the county. We got to make sure we keep our nose in it, otherwise they'll actually segregate all the different resource types. And FEMA has this habit of saying, well, it's not really that big, you should probably not apply. So we need to be integrated at that level. One of the things that I have in our emergency management strategic plan is to bring in a series of courses called senior and elected official training. And that's designed to teach people who are in elected roles or senior roles like a city or county administrator what their role is as a policy group when some type of a disaster occurs. So that's a training session that I think I brought to the chair vice chair meeting about a year ago as something that I want to bring forward. Originally the thought was bring it forward to the county board, but thinking through it more deeply, it actually makes sense to reach out to scale instead, because instead of having the county board do it at a county board meeting and inviting the cities, townships, school districts, tribal representatives, if we reach out to scale, we have hopefully a better chance at getting better buy-in and getting a wider audience that'll actually go through that training and understand then how to process through these things.
Okay. Thank you. Can I ask one other question? This was a question that came from one of the commissioners in 2018, and that is, as you look at the mandates, and there are many mandates here, are there things that, are there places where elected officials could advocate for you on mandates that maybe aren't adding value or are bureaucratic rather than really contributing to safety?
I think on our level, one of the difficult things is our mandates come from the federal level, and I think it applies to public health as well. So from a lobbying standpoint, we'd have to be able to lobby at the federal level. And I don't know that that's something the county's interested in spending that kind of money for.
There is this, and it's federally and statewide, is when there's an emergency, it often takes a long time to release funds to respond. And so there's been discussion, and Captain Haas or Lisa, you know more than I do, can kind of step in, but there's been discussion at the state level of having a fund that would be there and ready to easily release versus having to respond. So sometimes an example would be in Ebola. There has been criticism about the time it took some of the United States to respond to that, but it was because they had to step through the hoops to get the money released. And so the hope is to have a response fund that could be quickly released versus having to have a declared emergency and then kind of do the steps backwards. So that's one area.
Yeah, and to put things in perspective, in March, we had our flooding in Jordan. We are just now getting all of our costs submitted to FEMA. So understand the length of the current process. And it occurs, so the county will do a declaration where we, ultimately the board is saying, go get money or go take some type of action through that emergency declaration. After that, then we're reliant on the state to do a declaration. After that, then once the state declares and says they believe it's to the federal threshold, then the state will make a request to the feds. FEMA will evaluate that, do a preliminary damage assessment, look at the dollars, and then eventually that goes to the desk of the president. And once the president signs it, then we become a federally declared disaster. A month or two after that, FEMA actually will show up in town and start renting space. Once they rent space, then they'll start setting up the meetings where they'll first start going through that cost. So it's very common in the current setup that it's 6 to 9 months before we see a dollar on any kind of a disaster.
Maybe we'll stop at this point and open it for questions from the audience.
So my question is, you talked a lot throughout your delivery of the data, and thank you very much. It was very informative. You also called out a lot of the issues that we have, particularly around the area of staffing. We are a conservative county, so we don't staff many things at the level that if an event occurs that we can respond. So with that, do you talk about the training with scale leaders and making sure that our staff knows what their functions are and they're properly trained. But in an event, when you know that you have to coordinate with multiple cities, the tribe, and whoever else, do you have that consolidated plan where when you go into a training, there's a unified approach with all of our public and private partners that we understand and we agree upon roles and responsibilities? Not that you get into training, you teach someone, and then, or you lay out the expectations, and then there's maybe a little bit debate.
So that's a complex question, and I'll try and answer it. So one of the challenges that we experience that makes it difficult to do that cleanly is that we run into jurisdictional lines. Again, referencing the Jordan flood event, the impact was in the city of Jordan, but the ice jam was actually out in Sand Creek Township. Because the township really didn't have a significant impact, they don't have a whole lot of incentive to solve that problem for Jordan. So Jordan ends up having to deal with that problem. When we deal with a disaster or large-scale emergency, as we've said, I think many times in the past, all emergencies start local. So the township has to have an emergency process for the township itself. Then each city has to have a process for the cities themselves, and then they work up through the county. And that's where the county's role really comes into trying to coordinate that. But what that looks like changes in any kind of a situation based on who's actually impacted, and if it's something widespread versus it's contained within a geographic area. So the components of NIMS are to standardize this process. That's why we are pushing out the NIMS training. It focuses on establishing a nationally standardized process for making decisions, for communicating, for understanding authorities and chain of command. That's why we push that out to try and establish that commonality. However, when it comes down to it, each entity still has their own budget, their own procurement rules, their own political concerns, and those are real, and that's what drives business decisions.
So I had one, back on page 5, and the board has 2 tactics, right? They even put this into their strategies after the last meeting, the priority to take a look at. And I'm assuming, you know, you talked about the resiliency in the community, that was one of the tactics. It was good to hear developing a work plan and a kind of a charter in that area. But one of them you didn't hit on was housing. You said the temporary went well, Scott, but when you highlight that one in red, what is it you're looking there, and what do we need to be focused on and working on?
So this is a challenging area. We know housing in Scott County is not something that we have a whole lot of surplus in. So when we're referring to this in the recovery stage of the capacity, what we're talking about is getting people back out of a shelter into long-term housing again. The fact that we can do a really good job at putting people in a shelter. We can get them, we can staff a shelter, we can keep that open for a couple weeks, but no one wants to live in a shelter. Where we have a gap is trying to figure out how we then take that displaced population and then get them into long-term housing. And that's an area that's a real challenge in Scott County because we have such a tight housing market. Take a scenario in Valley Green, there's about 1,000 residents. If that whole trailer park flooded and we were able to keep them sheltered for some time, where in the county would we find the ability to put 1,000 people into housing? That's why we're struggling with this from a long-term resiliency. If we're talking about recovery, we're talking about getting people back into a home. And with the tight housing market that we have and the expensive housing market that we have in Scott County, that's a real challenge. Especially, I just want to highlight real quickly, a lot of people think FEMA comes and gives them money after a disaster and that gets them back on their feet. I think we need to really understand FEMA's stance is you need to be insured. If your house has damage, the expectation is you go to your homeowner's insurance. If your house was flooded, the expectation is you had flood insurance or you had a backup rider on your homeowner's insurance for septic or sewer failure. The average amount of money that FEMA gives in a declaration, so in Houston a few years ago when they had literally 5 feet of rain, the average payout from FEMA to individuals was $2,500. So if you think about, you know, you've lost everything because you didn't have flood insurance, $2,500 doesn't pay for your hotel room. I mean, it's not gonna get you back on your feet. But that is only if we actually get to a big enough catastrophic disaster where FEMA actually provides money. Like on our flood in March, that situation wasn't big enough for FEMA to provide any direct assistance. So we're relying on our private sector partners to come in and try and rebuild houses and try and help people. And it's still going on. I know the Red Cross just 2 weeks ago provided 3 different residents of Valley Green another $850 in long-term care to improve their houses. There's still damage to their homes. So this is a gap area. And you know, one of the things we, I think, have to address is what's affordable housing look like in Scott County and how does that impact us then in a disaster? If people are living in a trailer park or starter home and they are, you know, living on a pension or they're living on a tight income, if they're struck with some kind of a disaster, what's moving forward look like for them? And that's quite frankly why we're dark red, and I don't know what the answer is to that. If we had to displace 1,000 people and put them in housing, I don't know how we would ever do that with this county.
Okay, that's a tough thing to transition off of.
Happy notes?
However, I think I will turn it back to you, Mr. Chair, for questions from the commissioners.
Very much appreciate that. Discussion. Members, any questions that you may have?
Well,
Yeah.
and that not knowing how to do that, I mean, I would think if we had an emergency, people would come forward, and if you painted it in the right way, they'd come forward in advance and say, in an event of an emergency, I've got 2 bedrooms that are vacant all the time. You know, I mean, there's got to be a lot of that kind of capacity in our county, and I would think if we promoted, would you make your home available in the event of an emergency to someone?
And I think short term, I agree. I think there'd be a lot of people who would open their homes to people who are displaced and need help. But if people are already living on the edge, and now they've lost their livelihood, and they've got little to no aid coming in. How do they move out of that then? And I think that we talk about transitions, you know, we real short term have a sheltering. We get people to someplace safe. Then we have more of a shift to a Red Cross shelter where they're going to have a bed and meals for a number of days. But there's a point where we got to get them out. And I think people would be open to, you know, assisting in that capacity. I think we have a lot of really great people in the county, but I don't know where that line is drawn. And I think after a month or two, even the nicest people start saying, okay, it's time to get out.
Since we're on that topic, I just want to jump in. So what it's the 1,000 residents, right? That's the number we're talking about. What do other counties do that look like us and that are near larger counties like, I mean, this is the first time we've had an issue, or a county like this has had an issue, or potential issue. What are they doing, whoever the they is? Do we know who the they is? What does that look like? Is it just temporary shelters in high schools with Red Cross, or is it something more, or what?
So I think a recent example that we can all reference is the fire at the Drake in Minneapolis. And in that situation, it kind of followed the same pattern of sheltering. People stayed in a Red Cross shelter for a number of weeks, and then Health and Human Services came in and tried to get those people into longer-term care. And some of that was, it was really a mix of locations. Some people went into kind of the short-stay hotels. Some people went into other assisted living environments where there was some assistance to get in there. But even that, I mean, I don't know if you recall the numbers from how many were displaced.
There was less than 30 families.
Right.
So, I mean,
But that was a
on small
significant
scale,
effort.
it's a huge effort.
Significant effort to find 30 families. If we were talking a larger event than that, I mean, if we were really talking about 1,000 people, the county may be buying land, and we may be ultimately looking for FEMA trailers and setting up a trailer park somewhere. And that, again, it's all dependent on the situation, but that may be something that we do. That part of our declaration is we're going to have to find a willing or unwilling landowner, and we're going to have to create infrastructure because we just don't have a number of houses that we could acquire and put people into, especially if they don't have the economic means to sustain that. I mean, just paying the taxes on a starter home, if you don't have any money, is not possible.
So, I mean, that would probably be the solution, because is there any county that sits back and says, oh, we got 1,000, we can warehouse, so to speak, 1,000 people at any given time. If something happens, if fire hail drops from the sky, boom, we can get them in. Nobody does that.
I don't believe so. I don't think anyone's just sitting on that kind of housing capacity. The market's just too tight here.
Right. Right, exactly. So I just wanted to jump on that.
Even the RTF would probably only hold about 100 people, not even.
Can't put people there. Sorry.
In an emergency, we might have to.
Am I good to go, Mr.
You are
Chairman?
good
All
to
right.
go.
I was waiting for the oral comment.
Great to go.
Scott, just a stray thought that occurred to me. I'm thinking of my experience in North Dakota with the man camps up there. I wonder if part of our emergency planning for 500 people would be just to identify sites where we could lay sewer and water within 5 days or something to sustain an influx of FEMA trailers. Because it's not just putting the trailers there, you gotta hook them up. And even if it's a temporary deal, we'll probably have to deal with building inspectors and all that stuff. But in an emergency situation, you would think that just having a site somewhere that you wouldn't even have to buy it, even if you worked with a willing landowner to put an option on it or something in the ungodly event that something really severe happens, we're going to do this. That's the plan. Just a thought that you might want to consider.
So this is, I talked earlier about the policy group and getting the elected official training brought forward, and this is exactly the kind of scenario why we want to bring this training forward. So ultimately, you as the policy or the county have to decide what is the threshold. I mean, you're opening the door to what we're going to be willing to buy. You know, just think it through a hypothetical situation. Would we take one of our parks that has sewer and water and be willing to shut that down as a park to provide temporary housing?
Sure.
It's a possibility. Some of them have sewer and water. It would be a possibility. The county already owns at least a component of many of the parks. If we had to go through a process of actually acquiring land and then running sewer and water to land, it's gonna take time. It's gonna take a long time.
Well, that's why I'm thinking, Mr. Chair, identifying sites where it's possible or less complicated might be a good thing. Might not be right adjacent to where a tornado hit or a flood happened. It might be several miles away. It might be in another county. So I would encourage you to consider our cousins over in Carver County. They're thinking these same things, and just because we have to cross the river, which brings me, the cousin comment brings me to my last thought, families. The family is the basic organizing unit of society, and there's a reason for that over the centuries that's developed. Because when things happen, oftentimes our first line of defense is mom and dad, aunts and uncles, brothers and sisters. And I'm thinking of my family scattered throughout this county, that when things happen, the first thing they do is pick up the phone, call mom and dad. Can we borrow a couple bedrooms for a couple months or something like that? And I'm sure that happens to a lot of folks. A lot of that immediate urgency when we have to get them out of a home and into a temporary shelter like a church or a gymnasium, a lot of those folks get absorbed back into the family structure. And that's something we ought to encourage, I would think.
And that's exactly what happened in the Jordan event. The first night, the attendance at the shelter was somewhere around 90 people in our temporary shelter. And by the time we got to night 3, there was about 13 people that were staying over. Living in a shelter is not a nice thing. It's not something you want to be in. It's uncomfortable. You're away from those things that, you know, are yours. It's really a humbling experience. People don't want to be in a shelter, and we've seen that, and I think that's common across the board. People will reach out and use whatever resources they can when that situation happens. What we have to worry about is, what about the people who don't have that close family tie, don't have the capacity to reach out, because they're going to call, and they're going to look for a solution. That's where we have to make those tough decisions.
And I think that goes back to Leslie's comment about your community resiliency. Resiliency is really returning to a new normalcy and having the ability to pick themselves up. And living in a temporary housing situation does not lend itself to resiliency. And so we really need to be thinking that forward and thinking about, there's a lot of long-term effects. There's not a lot of studies on recovery, but what there has been, especially coming out of Katrina, the long-term living in the FEMA shelters and what that does to your citizens and things like that is really important, I think, to think even the next step longer term.
Well, it's admirable, Mr. Chair, that we want to save their lives immediately and their pets. Thanks for thinking of that. But I'd encourage you to think about Benjamin Franklin's comment about help them, but don't make them too comfortable, or you start to impinge on that natural survival mode that needs to happen in people to improve their own lot or recover. Bad things happen. I'm glad to hear too, and this is my closing thought, that you're thinking and bringing into the discussion the private disaster recovery plans, because I know every factory in this town has a disaster plan in place, and employees know where to go and what to do when something happens at the glass plant at RAR. I know the railroads are famous for having people who are on site in a matter of hours picking pieces up. We ran into that in Blakely here a couple years ago, and so thank you for bringing them into the mix too, and making sure that we don't end up tramping on each other's toes while we're doing the Lord's work here. Thanks.
Mr. Chair, just more or less a comment. I think it's been great to hear the development and the thoughts over the last 2 years since you presented, and good for us to be better educated. The things that really stuck out to me, and probably through our scale, our Jordan flood example too, is the other entities and that jurisdictional work. So I mean, I really applaud the county and the city of Jordan, because that did go smoothly. But that could have, as I was watching that unfold, just egos or jurisdictional issues could have occurred, and that could have been a disaster in itself. So I really encourage us, and it's helped me broaden my thinking, that in some ways it doesn't matter how good our Scott County emergency management plan is, because every single thing that happens in Scott County is going to involve other jurisdictions, that it really has to be cooperative. And so reading about that and even some of the challenges with getting, you know, things like mutual aid agreements so that we would be eligible for funding instead of just sharing equipment like we do on a regular basis. I really see that as kind of, has to be one of the key things on our mind as we move this forward. And thanks for thinking about that. I know we're out of time, but additional comments on that and thoughts over the next couple of years, how we progress on that front, will be welcome in the future.
Any other questions or comments? Yeah, I just want to dovetail on that mutual aid. That was interesting, because on any kind of sizable impact, that it's not just a truck or a grader. It's for weeks, and so yeah, I would really encourage that as well. Do we need to look at having those mutual aids in place for such a time as hopefully this doesn't happen, but it will. Things happen.
Well, even in the Jordan example, the county used Prior Lakes Vector.
Oh, yeah.
FEMA will reimburse that at $85 an hour. But because of our handshake and supportive network, there was no reimbursement that we were eligible for.
Right.
So, because Prior Lake can't work in the county, because it's without mutual aid request. So it's real money that we are leaving on the table.
Well, and that's in my mind, when I think of scale, I think of that Prior Lake truck on County Road 69 in the city of Shakopee, alleviating underneath that, I think it was underneath the trestle.
Yep.
That is how it's supposed to be. And I pay federal taxes, so it'd be great to get some of that back home. So yeah, whatever we need to you know, look at that for different jurisdictions, and egos do play a part of that, but everyone wants to be reimbursed. I had one last question on silos. Kind of talked about some of the internal silos just with the Everbridge Code Red thing. Like I get that, the silo, human nature, but when the rubber meets the road, do the silos tend to flatten when the alarm bell goes off and something happened and we need to respond generally, or is it still tricky question, but does it flatten out? Do the holes get punched in so you can kind of see side to side, or is it still a very sticky wicket?
I think the answer to that is it depends. In public safety, I think there's a lot of flattening out where people are pretty good at working with each other. But as we look through other organizational elements, I don't know that that is very good. I mean, Kevin Nelson is in the back of the room. He's in a quasi-preparedness kind of role along with Rhonda, and here's Alexa and Lisa, and I'm here. So if you look at just our county, the point of that is that if you look at Kevin and Rhonda, they work in this building under employee relations. Alexa and Lisa work in MRTS under public health, and then I work under the sheriff. So if you look at just that same, if we're really at a high level and we think about what's good for the county long term, it probably doesn't put us all in separate buildings, because that alone is a thing that's difficult to defeat. So what that looks like, I don't know, but that's why I think over the next 5 years we have to have a conversation. What does that look like? What should it look like? You know, I'm here because my deputy director is out of state on vacation, and I'm actually sitting here with a cold. Sorry, Alexa.
Probably gave it to you.
But probably, but I mean, calling in this morning wasn't viable because it's me to represent our. So if we were to think holistically and really have what's the right solution, if we had those resources all working towards a common good in the same organization, whatever that looks like. It just seems to me like that's a better solution for where we are, say, 5 years from now, instead of being siloed in different buildings.
So if I can just touch on that really quick. Personally, in my role, I have never, when rubber meets the road, not had someone come in, but the need for catch-up slows the response. And it can make it really difficult, even just understanding response in general. So to have, someone step in that might not know incident command and try to integrate them because we need them, but they don't have that understanding is really difficult and can kind of impede your response. I think we're doing a really good job with coronavirus. We were all working a little separately, and then we all said, whoa, stop, 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 stop. And I sent an email last week, and we established a couple triggers and some thresholds, and we had a conversation, and so we're having a talk together, but right away, I forgot Rhonda, and Cheryl said, include Rhonda, and so it's a work in progress, but if we don't do it beforehand, it's really hard in the response level.
It seems like we as a county do, maybe it's because of our size, whatever, still a fairly open line of communication amongst the different groups and departments, which is huge, even when we're scattered in different buildings. But I applaud the effort of always having those open lines of discussion. We're always open to having those discussions. And it seems like maybe we are getting better because we're experienced in all these weather-related events that seem to keep happening. But this is some great food for thought. Is there any last comments before we close this section down? Thank you guys very much.
Thank you very much.
Appreciate it. Are we gonna take a slight recess? All right. We'll recess for room reconfiguration.
Good job, guys. Sitting next to you are coughing on me.
Thank you. Sorry.
It is how that works. All right, we are back from recess. I'm gonna go to the next item on the agenda, which is the consent agenda. These are all items that will pass in one motion and have been thoroughly vetted through the staff. 7.1, approve the renewal application for Scott County Precious Metal Dealer License for 2020 from Mark Smith, DBA Pawn Exchange LLC. 7.2, approve the renewal application for a Scott County 3-2 malt liquor and retail license for 2020 for Andrew Huss, DBA St. Benedict Baseball Association. 7.3, approve the 2020 intoxicating liquor license renewal application for Creeks Bend Golf Course, Inc. Excuse me. 7.4, approve the request for a preliminary plat of Crescent Curve LLC application and property owner, consisting of 23 lots on 85.89 acres in sections 27 and 34 of Credit River Township. 7.5, approve the request for rezoning, preliminary plat, and final plat of Nordling Woods Edition, Greg and Andrea Nordling applicants and property owners, in section 14 of New Market Township. 7.6, approve the request for rezoning, preliminary plat, and final plat of Legacy Edition, Steve and Tony Shimmick applicants and ALS LLC property owners, in section 13 of Spring Lake Township. 7.7, approve the request to grant a 60-day extension to On-Site Marketing Company, Inc., applicants and property owners to record the final plat of Terra Farm located in section 26, Credit River Township. 7.8, adopt resolution number 2020-026, approving a 3-year agreement between the County of Scott and Law Enforcement Labor Services, Inc., Sheriff Essential Employee Corrections Sergeants Unit, effective January 1st, 2020 through December 31st, 2022, and rescinding resolution number 2017-026. 7.9, adopt resolution number 2020-029, approving a 3-year agreement between the County of Scott and American Federation of State, County, and Municipal Employees, Council Number 5, Local 2440, effective January 1st, 2020 through December 31st, 2022, and rescinding resolution number 2016-198. 7.10, adopt resolution number 2020-027, approving the summary of performance evaluation and establishing the 2020 salary for County Administrator Leslie Vermillion, and rescinding resolution number 2018-157. 7.11, approve payroll processing of personnel actions. 7.12, approve the reappointment of Jesse Hartman to the Lower Min River Watershed District Board of Managers. 7.13, adopt resolution number 2020-024, approving execution of a purchase agreement to acquire real property located at 17665 Marshall Road in Spring Lake Township by an early voluntary acquisition by mutual agreement. 7.14, adopt resolution number 2020-028, authorizing submittal of an Infrastructure for Rebuilding America grant application for US 169 Freight Mobility and Safety Investments in Jordan project. 7.15, approve record of disbursements and approve claims. Those are the items on the consent agenda. Are there any that you would like pulled for further discussion?
Mr. Chair, I move approval. Second.
We have a motion and a second. Any further discussion? All in favor, say aye.
Aye.
Aye. Motion carries. All right, we're gonna move to 8.1, where we're gonna adopt resolution number 2020-025, authorizing support of volunteer driver legislation and the Volunteer Driver Coalition to support such volunteer drivers. Alan, take it away.
Good morning, Mr. Chair and Commissioners. I'm here to ask you to support adopt resolution number 2025-025, authorizing support of volunteer driver legislation and the Volunteer Driver Coalition to support volunteer drivers of Scott and Carver counties. Scott and Carver counties have had a long tradition of volunteer driver program. Basically, this coalition has been formed both for the government side and also the pieces of the nonprofits, and asking 4 key points in this legislation. One is basically to clarify define a volunteer driver as a not-for-hire. What's happening here is basically with the onset of Uber and Lyft type drivers, there's confusion in the insurance industry about what is a volunteer. Are they paid for? Are they for hire? This basically legislation helps to clarify that piece in there and again support that piece moving forward. Point 2 basically is again protecting that volunteer drivers from increasing insurance rates. So insurance companies, as they struggle with this, have been actually increasing, saying you are a for-hire type driver, and thus we need to increase your insurance rates based on that. Point 3 is creating a state income tax subtraction for volunteer drivers to reduce their tax liability in Minnesota. This particular piece, we're not sure if it's actually going to be a part of the legislation. We might have to pull this out because this is not a budget year in Congress or in the state legislature, so we might have to pull this piece out. But if they allow it, this would basically give a credit to a volunteer driver on the state taxes if they had to pay a 1099 for their basically their rates of 54.5 cents, which is the business rate for volunteer for the IRS versus a volunteer rate of 14 cents. So there's a difference. So right now we actually give the volunteer drivers a 1099 for any amount over $600 that they receive. So they pay that then on a 1099 to the federal government. This would then ask for a credit on their state taxes in that same type of mix. The fourth piece is capping the liability of nonprofit organizations that offer volunteer drivers services at $1.5 million. The government agencies basically have that already in place. This basically helps the nonprofits have that same type of insurance level and so forth moving forward. Just want to show you also the current coalition members, which is growing each and every day. But again, these are basically members that are in support of this legislation moving forward. Just wanted to also show you also some of the statistics we've had in the last 4 years for volunteer drivers. So as you can see, some of the over the 4 years in 16 and 17, the number of trips, but then also the number of hours that the volunteers perform. And you see that dip from 17 to 18. Two things happened during that time. One was Scott County enacted the additional hours for dial-a-ride, so that actually took some of the pressure down from for the volunteers. But then also in 17 was when we started to give them a 1099. So we don't know which one is which, but again, any help on this would also help them moving forward.
Just a quick question, Alan. Obviously, if they go the 58 cents or whatever it is, that's 1,000 miles is below the 600, just slightly. How many volunteer drivers are going over 1,000 miles? How many are needing a 1099 under this new system?
Right now, about 6 of them of the 23 we have receive a 1099.
Okay.
Yeah, it'd be interesting to find out, was it the dial-a-ride or was it a 1099?
Some well, there's a combination. So actually, we do know one particular volunteer driver that actually left because of insurance. Some of the newer ones coming in, they don't want to say it, but a lot of times it is that 1099 as a piece of that piece. And then again, that same thing, that which is it? Or was it the fact that, again, we've actually doing more things with the dial-a-ride services also?
I'm just going to look to my left here because Commissioner Ulrich, you speak to this quite a bit, and this is still a huge piece for us. Am I right? I mean, I know it's dropped for who knows what specific reason, but this is still a big deal. And one of the questions I have is like on these coalition members, I see Dakota counties on here, but is it just us county-wise versus some of these seemingly, I don't want to say private, but like, is it not a big deal to other counties?
Mr. Chair, Commissioners, I do know that Anoka County and also Washington County are working on the same type of piece that we are. And actually Carver County wanted the board action that I created here to simulate in their county. So I know those 3 counties are also working on this same approval.
Just in a
Just
different.
started. This whole
Okay,
effort just
okay,
started.
all right. But are they looking at jumping, so we're a tip of a spear together?
Yes.
Okay, got it. All right, thank you. That's helpful for me.
Mr. Chair?
Yeah.
And Alan, I think this is true, but we, in our plans, we want to continue using volunteer drivers. We think this is a good thing, right? I mean, I think our board thinks it's a good thing. This is part of our going forward. We want more, right? We're
Absolutely,
still
yes,
there.
yes.
Good.
And this
Okay.
helps with
Say
that
for
support.
everybody
Yes.
listening. Yeah.
Yes.
One more comment, and I've made this to you already, but let's say that this is delayed, it's not enacted right away at the legislature.
They're so speedy.
Yeah, there's speedy legislative action. I think that we ought to, on a case by case, talk to our drivers and say, okay, what has your insurance company said to you about the increased cost? Now, I'm not a driver, but I did call my insurance company just to test this out, and it was a very modest amount of increase, but there was some. I think we ought to explore what that is and pay that for our volunteer drivers, until this gets solved or whatever. So, yeah, that's my opinion.
Mr. Chair, Commissioner, yes, we can absolutely look at that and see what that possible impact would be. I'm sure it's different for each scenario, and even, for instance, we've helped particular insurance agents understand the difference between a volunteer driver and a for-hire type driver, and that's actually helped a lot of them understand that, no, we don't need to increase this because you are not a paid driver.
Right.
Yeah, and do we know if, the drivers that sign up for this program, okay, the numbers went down on your graph, but are we losing some of those drivers to, hey, if I'm already driving, let's go put a light in my front window and sign up for Uber, Lyft? Or is it a very different motivation?
Typically, Mr. Chair, Commissioners, typically a very different motivation. Usually ours are more on the senior, retired type of driver. And also, we are starting to see some of the younger ones coming in, but usually they are limited to maybe evenings or weekends. So we're kind of looking at that type of piece there.
Thank you. Any other questions? Yeah. Yeah.
Mr. Chairman, I'm glad we're working with these guys, with these drivers to work this out and collaborating with the other nonprofit agencies, because this is a big part of the whole mobility thing. The government had to pay to move every single person around when they needed moved. There isn't enough tax money to make that happen. Volunteers win on so many levels. And so, Mr. Chairman, I'm going to move that we adopt Resolution 2025-025, supporting this volunteer driver legislation effort. I urge its adoption, and I'm glad that you brought this forward to us, Ellen. Thanks.
Second.
We have a motion and a second. Any further discussion?
Just one additional comment,
Yes.
Mr. Chairman. I know that some of this, especially the IRS part, is a federal issue, and I know that our congressmen, people have been made aware of it, but again, there's an impact there, and it's making its way through the system slowly. But this actually, only can be fixed by Congress. We can
Yes.
kind of tweak around the edges here, so that's what we're trying to do. Appreciate the effort, but know that it has to come from Washington, not the final fix.
All right, very good. We've got a motion and a second. Do you have a
Well,
comment?
there is do you want to kind of explain, did that not get explained what this is, what you're trying to do with this legislation? It's to make them whole after the taxes, that's understood here?
Correct.
Okay, all right, yeah, okay.
All right, let's put it to a vote. All in favor, say aye.
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 Opposed? Adopted. Thank you very much. Appreciate that.
Thank you very much. Thank you.
All right, moving on to 9.1, an informational presentation on a cost of community services study in Scott County, prepared in partnership with the U of M, and Brad is at the podium.
All right, thank you, Mr. Chair. Thank you for allowing us just a few minutes to present a study that was recently done. So this is just for information this morning. We're not looking for any formal action. Get my slides. Can you get the PowerPoint up, please? So just a little bit of background before I turn it over to Taryn. When we were going through our 2040 comprehensive plan, we had a lot of good discussion in some of our townships on different development patterns, different density patterns. And I think a really good healthy debate in a couple of our townships on what's sustainable when you look at maybe moving to a different density pattern, maybe allowing some more homes in some of our farming areas, and maybe changing some of the lot sizes in our rural residential areas. And with those good debates, there was a lot of discussion about what's the impact these decisions have on some of our budgets, both at the township level and at the county level. How much does it really cost the public to serve these types of density patterns? And kind of what's the impact if we start looking at changing those patterns? This is a map of the 2040 plan land use map. And I just put this map up just to remind you kind of where some of these good debates and discussions were occurring. In Helena Township, the south part of their township is in white. That's our long-term agricultural preservation area where the planned densities is 1 home for every 40 acres. And that's a town board that's kind of thought about, maybe we should start looking at changing that density and maybe opening it up for a little bit more housing, maybe going to a 1 home per 10. And that's where we started talking about, well, do we have the infrastructure in place to support that development? And then what impact would that decision have longer term? Kind of what's the sustainability of changing those development patterns? In Cedar Lake Township, in the pink area, there we had kind of an opposite debate about right now there is some higher density, comparably higher density, 1 home per 8 acres, and clustering that density. And we had a lot of folks in that township saying that's too much development for our township right now. It's costing us a lot to maintain some of the roads to serve that development pattern. Maybe we should look at actually going up from that to maybe a 1 per 10. But it was the same debate, kind of thinking long term, what are those, how do those decisions impact? And so I think when we had entered those debates and brought some of that information to our planning commission and ultimately to you as the board, I think there was a lot of recognition that our zoning and land use decisions do have an impact on budgets, certainly the county budget, both kind of thinking about the money going out to serve those development patterns and what's the money coming in off of property values and assessments. It's a little bit hard to quantify that impact. We could make some general statements, but we needed help. And another way of thinking about this that came up a lot at some of our meetings is, are certain land uses paying their own way by generating enough revenue to cover the cost of the services they require? So we started at a staff level saying, well, how can we start addressing some of these really good questions that we're hearing? We needed some help coming up with a methodology. About that same time, we'd agreed to partner with the University of Minnesota and the Resilient Communities Project. And so when we proposed our different topics for students to look at, this was one of them, helping us kind of assess the fiscal impact of some of our land use decisions. So Taryn Meyer is here today, a PhD student at the U, and he agreed to take this project on and started helping us kind of figure out the best methodology to tackle this question through one of his public finance courses. And to my knowledge, this is the first time that the Resilient Communities Partnership looked at this type of study. How can a county sustain its public expenditures on different services and infrastructure to support different land use types? No other county or city had really asked that question, so I think the U of M was interested in making sure that we could get set up with a course to take a look at this question. I'll come back after Taryn presents just a high overview of the study. You have a copy of the study in your packet. I know there's a lot of information. We just want to give you some of the highlights and maybe some things to think about, and I'll come back and talk about what we're going to do with this information. But I'll turn it over to Taryn.
Thank you. Taryn, welcome.
Hello, thanks so much for having me. I'm, as Brad said, I'm a PhD student. I study local government, but rarely have an opportunity to speak with local government officials, so it's a real pleasure. This is making my week, maybe my month. So I really appreciate the opportunity to be here. So the results that I'm going to show you are what I'll call sort of a modified cost of community services ratio. And the question that this answers is how many dollars are spent per dollar raised for the given land use types that are defined by the zoning classifications within Scott County. I'll tell you a little bit about why I call this modified relative to the cost of community service studies that have been done across the country in just a minute. But as you can see, basically, as you look across the land use types, this basically tells you some sense of which land use types are paying their own way. And in agricultural land, it's estimated that the county spends $1.25 for every dollar that it brings in. Whereas in commercial and industrial parts of the county is only spending 37 cents on the dollar from revenue that it's raised. You'll see that there's a municipal category that's definitely not a zoning classification of the county, but for the purpose of this analysis, we excluded the parts of the county that are in cities and treated that as a separate land use type so that we could look in a granular kind of way across the land use types within the county. So, okay, how do we know this, right? You might ask. So here's another way of sort of thinking about the results, which you'll see in some of the outreach material that we create as well. How do we know this? Well, so this is a technique that really is just a reorganization of data that you already have. This technique was pioneered by the American Farmland Trust, where it's happened in cities and in counties, only a few times in Minnesota, but a lot in other Midwestern states and in the Northeast. And the idea is to reorganize publicly available data. So these are data sources that you all are already preparing for the county annual financial reports. They're publicly available at the state auditor's website in a convenient way. You also are doing great work putting your data available on the OpenGov website. There's one additional sort of inside link was working with the folks in your revenue department to look at parcel level tax payment data. And then you'll see I also collected a bunch of data from other units of government that overlap within the county borders. Now, after you have this data, there's really a key analysis step that is trying to attribute the costs and the revenues to the different land use types. And here, what we're doing is the attribution technique relies on really the expert knowledge of your county staff to try and identify key cost drivers for each of the line items in the budget. So it's a little bit easy on the property tax revenue side because we're using parcel level data. So those parcels are already zoned. It's easy to just sum up the amount of revenue that's coming off of those different land use types. So that's pretty easy. You have to sort of make case-by-case determinations based on the different types of expenditures. So this next line for 911 or county attorney or customer services, we basically said, these are basically driven by population. So we're going to take the population distribution across the different land use types using publicly available census data and some geographic information system sort of analyses just to figure out how many people are living in these different land use types within the county. Road maintenance and construction, that's a little bit hard to get your mind around, right? Because roads are intentionally about moving people across the parts of the county. But the way that we did was we said, really these costs are driven by lane miles. And so we associated the lane miles with the different areas of the county that they serve. So roughly speaking, we say if a road, lane miles in a road are near an agricultural area, we're gonna sort of basically estimate that that road is servicing a dominantly agricultural area. And then we just took the outlays, both capital and maintenance costs that you've spent between 2012 and 2016, and averaged them, associated with them with the roads, and figured out basically how to attribute the road costs to the different land use types. Intergovernmental revenues are sort of a challenge. Basically, our methodology was to figure out, when you get grants from the federal government or the state, what are they for? Associate that with a particular department within the county, and then use whatever dominant sort of attribution technique is being used in that department. So if the department, we think its expenditures are primarily driven by population, then the intergovernmental revenue that you get is also then apportioned by population. So there are, of course, going to be categories where there's an unknown or sort of ambiguous geographic footprint. And since the main analysis here is which land uses are paying their own way, when you get down to an expense category that you're not sure sort of where it lands in the county, the thing that you want to do is to try and hold harmless like any of the land uses for that expense. So since so much of the revenue is driven by property tax revenue, the default becomes whatever the attribution is across land use types from property taxes. Basically what this means is that if you don't know where the money is being spent across the county, you don't distort the dollar spent per dollar raised for each land use type, because you just hold it equal to the revenue that's coming off of the different land use types. Maybe I didn't explain that particularly clearly, but generally speaking, you do all this attribution, and then that gives you these ratios that you have. So because I'm training to be an academic, I will naturally do this, some context and cautions, you know, try to hedge the impact of the results a little bit. So this differs from other cost of community service studies, which actually estimate that farmland cost of community service ratios are less than, that should be 1, sorry. It should be basically, a lot of cost of community service studies estimate that you don't spend more than $1 for every dollar that you raise off of farmland. But, and you know, this makes sense if this was a technique pioneered by the American Farmland Trust, right? Their interest is in preserving farmland. They do something that we thought didn't make a ton of sense, which is that they take out homes and farmsteads from the agricultural category. So the question that they're answering is really just like the working lands themselves, what kind of costs do they require? We thought that it would be more useful to you all to use the actual zoning classifications, and in the zoning classifications, people live in farmland. And so, but this is where our results sort of diverge from the cost of community service studies in the past, because we're counting the people that live in the agricultural land, and a lot of county expenses are driven by serving people. So our ratios end up different on that account. The other thing that I'd say is that there's sort of and this is subtle, there's a difference between average and marginal cost. So people who have studied economics might recognize those terms, but I've been showing you numbers that are average expenditures and revenues from the 2012 to 2016 period. And so that's a snapshot in time. You might look at these and you might say, okay, well, if we increase the residential properties in the county by 1% and reduce it from somewhere else, that should mean something for our budget, right? And you could maybe do that. These results are potentially suggestive for like thinking about maybe 1 or 2% changes, but they're probably not the same thing as thinking, oh, if we radically adjusted the zoning classifications within our county. And that's because the way that expenses scale with the amount of the county that's in that land use type might not be linear, right? Like it might be the case that you add 10 or 20% residential property, and what's not reflected here is that you might have to have 2 additional fire stations, right? And that's like chunky expenditures that come in that aren't going to be captured by this average cost sort of method. And so in some sense, use with caution. This is a first step, but maybe not the level of detail that you'd want to have if you were undergoing radical changes in how the landscape is zoned within the county. So the last thing that I'll say is that because this was based on publicly available data, I didn't just do this for the county. I also took the revenue and expenditures for the school, township, city, and then produced an overall cost of community service ratio. And so the reason I did this is because part of the thing that I think is interesting about local government is just the way in which there's overlapping units of government, and that the property tax or bill that taxpayers see is not entirely within your control, right? It's the result of a whole bunch of additional layers of government that are driven in part by the decisions that you make about land use. So the school line item, for example, right here I'm just showing you the ratios, but if you were to look at the actual report, you'll see that the overall ratios are highly influenced by the school ratios because there's just so much money being spent on public education, right? So this is, additional information to present to you all, just to think like, as you all start to think about these land use based kinds of thinking, it also opens up potentially conversations with your peers and colleagues in other units of government that are also interdependently impacted by the decisions that you make. So the other thing that I want to say is a lot of thanks to your staff. Like, this is not possible without the expertise of county staff members, that include this number of people who are able to provide data and help sort of explain how to understand what is driving costs. To your credit, Scott County is really the first in the metro to be undertaking this kind of analyses. I called around to try and see if neighboring counties had done this kind of study, and nobody really had. So you're out in front, and you've got staff that are willing to think through how to put the data that you already have to work to develop some deeper insights about the county's impact on the economy and the regional spending. So thanks so much.
Thank you.
Taryn can stay for questions, but I just have a few more slides to wrap it up. Just to provide a little perspective, this is the third time that Scott County has been kind of the subject of different fiscal impact studies since the 1990s. The first one, the Department of Ag did a report back in 1999, and they looked at 5 different counties across the state, and Scott County was one of them. Different methodology, but trying to kind of think about the same questions. This was focused probably more on housing development more than anything, but I just put there on the slide some of the key takeaways that came out of that 1999 study. Some generally accepted findings, I think, that generally new housing development contributes more in taxes than it requires in services, but the caution there is only when it's built within or adjacent to established urban areas. Some logic to that you have the infrastructure right next to these new housing developments. Again, the Department of Ag found that vacant farmland, so again, like Taryn said, they did not include the homes or farmsteads in those areas, contribute more in taxes than it requires in services. And I thought a really interesting finding that the townships have, I think, been thinking about more and more, some of our growing townships, and that is when townships reach a certain population threshold, that per capita road maintenance costs double. And I know we have a lot of townships about at that 3,500 population that are starting to think about the long-term sustainability of maintaining their roads. and what it takes to add more road lane miles into their inventory. In 2001, the Met Council did a similar type of fiscal impact look. Again, findings are pretty generally accepted. Compact housing produces more net revenue per acre than sprawling development patterns. Retail development produces proportionately more property tax revenue than other types of land use, but there is important, also requires higher public costs to serve, namely some of the transportation investments that are needed to support retail development, some of the public safety services. And that generally, commercial industrial generally produces more net revenue. So just to wrap it up, as Taryn said, this is really a high-level analysis. We don't claim that we have precise dollar amounts that we're going to go out and start using to make radical changes here. I think it can just inform us. Maybe if we do go to more of a township or a detailed area plan, that's the DAP geography, where we kind of focused in on a certain type of land use. Maybe this high-level analysis can help inform and kind of set the stage for a deeper look into some of those geographies. I think it really can inform some of the conversations we're having here at the county and in our townships, again, looking at the long-term sustainability of financing our local road maintenance. It's a discussion that comes up a lot when we're talking about turnbacks with some of our townships. Some of our roads are gravel, and we've talked about they're paved, and we're talking about reverting them back to gravel. And so I think there's just a lot of good data here to think about when we have those different discussions. And then, believe it or not, in about 2 to 3 years, we'll be talking about the 2050 planning cycle, and I think we can come with some of this information back to some of those townships I mentioned at the beginning of the presentation and start thinking through some of the different land use densities and development patterns in their townships. That is it. We'll stand for any questions or comments or reactions to the discussion.
Thank you both very much. Members, any questions, comments? Yes, sir.
Mr. Chairman, I remember, Brad, and back in my city council days in the 90s, we had a study kind of like this, looking at city services. And we found that residential housing did not pay its way when you aggregated all the services necessary, police, fire, sewer, water, street maintenance, and education. And I think we had a component in there on the average family size, so we kind of assigned a school cost to those units of buildings, but in the industrial park or in the farmland area, we did not. And so we kind of separated those out. And obviously, commercial industrial had a huge net margin for us, and even the farmland that was still in the city limits was kind of a net contributor to the city coffers, but the small houses in a grid pattern, not so much.
Yeah, I think that could have been the 2001 Met Council study. They did pick 5 or 6 cities across the metro, and I think Shakopee was one of their cities that they looked at, so that is true.
But still, this is fascinating stuff. Thank you for moving in this direction for us.
You bet.
Mr. Chair, thanks. Great study, really interesting, really thought-provoking. I'm just trying to be ready. I have most agricultural land in this county, and I can just see some of my district constituents not agreeing with this. My question would be, and this may have some bearing, it may not. So if we look at the expenditure side, the 3 largest cost drivers are that general government, health and human services, and public safety. Do we have any data on, where people live, whether it's, let's just compare municipalities to agricultural land, whether the use, because I assume it's a blended population. This is how much the population, if there's 10 people here and 100 people here, we did it per capita. Now, I think some people would say just based on how people gather and income levels and other things that could be very different across where people live. Thoughts?
Mr. Commissioner, yeah, I think to a certain extent we're limited by the data that we have available. The population level data is only available for census blocks, which are pretty big within less dense population or parts of the county. So to a certain extent, it might be driven by how best I could get people in different parts of the county. Then the other thing is that we made a simplifying assumption to say a lot of these general government services, we're going to just say on a population based level. You do have, we thought about taking 911 data, for example,
exactly.
or some of the data that is available in your Health and Human Services budgets, and then saying, but there's privacy issues with that second piece, and then really the key question that you want to ask is, are residents of rural parts of the county using less services than average? Because if it's just on average, basically, a person, regardless of whether they live in a city or a rural part of the county, on average, demands equal services from the county, then it's not going to make much of a difference if we just sort of use it on a population basis. But that's an open question. Our prior was basically people are people. Let's make this simplifying assumption. But it may certainly be the case that health costs are higher in cities on average than in other parts of the state, or that public safety requirements are higher in cities than. And you have the data to figure out how to go about doing that. So. Certainly it's an interesting question.
Yeah, thank you. And I understand, I wasn't trying to, it may be that in some areas, those costs of services are higher per capita, in rural areas sometimes lower, and I think that was just important to bring out that wasn't considered in the study, so thank you.
Commissioner Bricky, I kind of thought about the same thing when I started seeing the results, and I approached it maybe more on the revenue side, whether some of our agricultural parcels and the tax differentials on some of the programs through either Green Acres, the Egg Preserve program. I know Green Acres is much more prevalent. I just wonder too if maybe that changes the revenue coming inside of it, that looks like that you're over that dollar amount, where if you remove that, you probably would be back to those land uses paying their own way. But I haven't been able to explore that entirely, but it was one thought I had.
Yeah, I agree. I think that's very telling in this study, and that is probably good for us to be able to articulate. So if we can get a little more information on it, that might be helpful.
Yep.
Thank you.
Yeah, this is an interesting study. Brad, the study that I was trying to remember, I think you handed me a study like 2 or 3 years ago. Was it that old Met Council, or was it a nationwide? I cannot remember.
Yeah, Mr. Chair, it was the 1999 study from the Department of Ag.
Okay, okay, all right. And that was where, because like Commissioner Beard, I've always sort of been under the assumption that households don't necessarily float the boat. But this is saying, with some of the assumptions that at current spending levels, it's floating the boat, but it's just a step in the data process of, what do the true numbers look like based on these different classifications. It's an interesting topic of discussion for sure. Any other questions or comments? One last for Brad, both of you, when you went through this, was there one aha or oh my, once you compiled some of this data, like, whoa, I wasn't expecting that, or that's surprising, positive or negative, whatever, which way?
I think that the findings that sort of run contrary to the dominant cost of community service findings about agricultural and working lands, because I had looked at those studies but hadn't really realized how significant it would be to exclude homestead residences within those working lands, and it from a researcher perspective, it felt like it felt like a somewhat arbitrary choice on their part, or it just feels like it's hard to know how, from the process of sort of trying to generate knowledge in as objective a way as possible, how that one choice really dramatically changes the impact. And ultimately, I feel like it's a pretty philosophical choice. It's like, do you think about the agricultural part of your county? Is its value as a place where people live, or is its value as a place where, you know, there's productivity off the land? And if you think of it one way, you get one answer, and if you think of it another way, you get another answer. So I think for me in my own development, it's just sort of recognizing how much there are these decision points on the part of the researcher that really shape some of the findings. So I've tried to be as transparent as possible about when those decisions came up and the way that they affected the results. Okay.
Great, thank you.
For me, the biggest surprise share was probably the rural residential. I guess I went into this study thinking that we do pay more in services to some of our rural residential areas than what showed up in the results. My best speculation is probably because of some of the property values in our rural residential areas. They're paying a significant part of their property taxes based on that valuation, so that might skew the numbers, whereas if we went to outstate Minnesota and looked at a rural residential area, my guess is their county probably is spending more than money coming in to serve kind of those distant rural residential pockets. So that was probably my surprise from the study.
Well, great, Brad and Taryn, thank you guys both very much, and I know this was a bit much bigger to do, for sure, but thanks for all who participated in that study. Thank you very much. All right, we are moving on to item 10, committee reports and commissioner updates. Looking down to my right, District 1.
Thank you. On February 6th, I attended Justice Steering Committee. Much of the discussion there had to do with the building project, the staging, the refurbishment of the courtroom in the jail. So lots of progress, lots of good input from all the stakeholders so that we can get it right.
And they're excited. They're excited.
Yes, I mean, if it could be done tomorrow, that would be
Awesome.
helpful. February 6th, also on February 6th, had Together We Can subcommittee meeting. Of course, that's our collaborative group about ending child abuse and neglect in Scott County. And then that evening, I attended the Jordan Lions Scholarship Fundraiser at Ridges in Jordan, well attended. Good evening. February 7th was my monthly meeting with the county administrator. On Monday, February 10th, I went to New Prague High School and did future leaders presentations there. Students were interested, and we had a real good increase in the number of students last year who attended from New Prague, so hopefully the same this year. That evening, Human Services Resource Council that had some new members. It was nice to see people from all over the county joining that group. February 11th in the morning, I had my quarterly meeting with the New Prague mayor and city administrator and our county administrator to talk about mostly road issues, but a few other collaborative issues between the county and the city. February 11th in the evening, attended the Sessions Priorities event with the Shakopee Chamber of Commerce. Heard from the legislative leaders, Governor Waltz. It was only day one, so I think there's more to come, but it was a good kickoff. February 12th had the Scott County Historical Society board meeting. The Scott County Historical Society did receive the full grant for redoing the HVAC system in the museum. Bids were gotten, are being accepted right now, and that project should be done in March with a grand reopening in April. So you'll all hear more about that. February 13th, attended part of the FISH meeting. The part I attended, a representative from NAMI talked about mental health, and then after that, our own staff from Children's Mental Health were going to present. Had lunch that day with Tammy McCullough from the University of Minnesota Extension Service to talk about staffing and some of the programming going on here in Scott County. And then later on February 13th, had a quarterly meeting with the mayor of Jordan, city administrator, and our county administrator. Talked a lot about the interchange project. They have an open house coming up for their community on, I feel like it's really soon. I think it's this week, yes, or next week, February 20th from 4:30 to 6, Jordan City Council Chambers, talking about that interchange project. And then February 14th, attended the SCALE meeting. That's the end of my report.
Thank you very much. Commissioner Wolf.
Thank you, Mr. Chair. On the 4th, Newmarket Township had their monthly meeting. On the 5th, Prior Lake Spring Lake Watershed had a meeting on some new ideas and rules. After that was at the Savage ELC, the 13 Dakota Avenue down by the grain elevators and stuff. They're gonna redo that, and they just had some, lots of maps out there showing what's gonna happen, so I think that'd be very nice once that's completed. It may take a while yet. I don't remember how long that's gonna be, Lisa. I see Lisa's on. How long is the 101 out by the grain elevators? How long is that, when's the date on that gonna happen?
Are you speaking about the?
Yeah.
13.
Down to 13, yeah, yeah. No, the roads and stuff.
Dakota.
Dakota.
The 101,
Yeah.
The freight
Okay,
project.
it doesn't matter. The freight deal, yeah, skip it.
2022.
On the 6th, future, sorry about that, Lisa. So,
Not on 101, that's what threw me off.
yeah, okay.
13.
Oh, 13, I'm sorry, yeah. So, the 6th, the future leaders over in Shakopee. It was pretty good, I think, pretty good morning and early afternoon with those kids. I think they were 8th graders. I think the 8th graders are a little more attentive than the 9th graders for some odd reason. The candy goes over well because lunch was right around the corner, and I'll tell you, they eat those things up pretty good. Then on the 7th, I was over in Dakota County for the household hazardous waste facility that Dakota and Scott are gonna partner up on. Maybe it's gonna be somewhere in Burnsville or northern Lakeville, something that can serve the Savage, Burnsville, Lakeville area. They have one up in South St. Paul. We have one in Spring Lake Township, and it's kind of out of the way, but very well received. It was their legislative forum, so they had a number of legislators there. So let's see how that thing turns out. On the 11th, I was at the CDA meeting. On the 12th, the MESB in St. Paul. On the 12th, Prior Lake, we had a little meeting, talked a lot about the 21 Revere Avenue and a couple other items. That evening, I was at the Cedar Lake Sewer meeting. On the 13th, I-35 Solutions. That evening, Elko New Market had their twice monthly meeting, one of them. I just gave a report about the CDA kind of going forward, and they're going to set up a work group to talk about putting in the water and sewer out there, and they are very thankful. When I said it, the mayor and the administrator had known it, but the rest of the council was just surprised and very happy about that. So hopefully we can get that thing to go through. Then Spring Lake Township after that. Was at the scale meeting on Friday, and that is my report. Thank you.
Thank you very much. Commissioner Ulrich.
Yeah, I want to start off by saying I've been assigned to this Greater MSP Task Force on Economic Development, and sort of on my own, I asked Greater MSP to write me 6 questions that I could ask economic development folks in Scott County, so I could get a little fuller understanding of economic development issues and so forth. So I've done these interviews, and I had 7 of them in this period of time. And some of the things that have come up in those interviews, the barriers to economic development have been lack of pad sites, lack of ready pad sites, lack of places that land is ready to go for businesses to come in and locate. And behind the lack of pad sites is lack of infrastructure, sewer and water being primary, and then also lack of road infrastructure being available as well. And I didn't realize that there would be such a strong connection between these interviews and the feedback I was getting in the meeting that occurred at the CDA. And at the CDA, I actually asked to go first before we talked about the Elko New Market idea, with the business park down there and the future development down there. And I said, we have this issue that's really widespread, that everybody that I've talked to in Scott County that are leaders in economic development, and I will say the interviews have been so far, the 7 that I've done, I think I've done 10 so far, but it's been Frank Boyles, Leslie Vermillion, Lisa Fries, Brad Davis, Barry Stock, Tom Nikkonen. Those are some of the interviews. And they've all had the same message, that the infrastructure and the sewer and water and roads are critical, and we don't have developable pad sites. So I said, there needs to be 2 different kinds of mechanisms, or 2 different ways to approach this. And I said, could the future, in terms of roads, could our, if we reenact the transportation sales tax, which is an if, you know, and that expires in 2022, could it have a sort of a beefed up economic development aspect where a project that in the past might have been in the middle of the pack, say, for a project, you know, and not, but maybe an economic development factor would move them to the top of the list. And 2 and 35 is a really good example, where that might have been, you know, could be in the middle of pack kind of project in the future, but maybe because of economic development, that would move that to the top of the list for future sales tax money. But that's just the road. And I said, now there needs to be a mechanism for sewer and water. How can we, you know, get everybody in the room, you know, whether it would be the developer, the landowner, the city, the CDA, and the county, some kind of mechanism where we can advance some of these business parks more than we have been. You know, how can we be a little more aggressive on this? With a payback, you know, if the CDA puts something up, or the county puts something up, or, you know, there'd have to be some payback formula. So anyhow, that's what this work group that Tom referred to is going to do, and I'm hoping it will be widespread, you know, with county folks and city folks and developers and landowners type. So that we really come up with something special. I think we have an opportunity to come up with something unique here that, you know, isn't being done or has not been done, maybe in the region, you know, and I don't know what it would look like or how it could be, but if we could have an advantage here in the way we do things and spur some of these things along, I think we'd be a great thing. So that's kind of an overview of a lot of what I've been doing. But so on the 5th, interview with Frank Boyles, and 6th, Leslie Vermillion, and then my administrative meeting with her, and then the Transportation Committee. Then the Fish Executive Committee, 7th, the Scale Executive Committee, 11th, Brad Davis interview, Barry Stock interview, and then the CDA meeting that was kind of I think the high point for myself and for Tom and for Elko Newmarket. It was a good result, and I think they should be pleased that we're going to look at this in a sort of a comprehensive way. And the 12th, another interview that I mentioned with Lisa Fries and Tom Nicken.
Excuse me.
And then a call-in interview with, or call-in with Brenner CP itself. And I've got other interviews coming up with like Bill Reynolds and so forth. So I'm really trying to get around the whole county for these interviews. That's in my report.
Great, thank you. Commissioner Beard.
Thank you, Mr. Chairman. On the 4th, I had a meeting with the Commissioner of Transportation in St. Paul. Talked about several things, including local roads and bridges and some of the projects we have in Scott County that are of interest. 169 is certainly on their radar, since she drives it several times a week going home to Butterfield. So it was good to spend some quality time talking about transportation issues and trying to be helpful there. On the 5th, the CAP Agency Finance Committee met. Just 2 quick notes there. This new CFO we have, wow, she's an amazing young woman, has really pulled the agency's bookkeeping and financials out of the weeds, straightened them out so that even I can understand them looking at it, and that's saying a lot. The Forms 990 have been filed in a timely fashion, and the audit, for the first time in many years, the audit came back with no notes, no derogatories, I should say. And oh, by the way, a new executive director has been hired at the CAP agency. He emailed me here the other day and is asking for coffee to introduce himself. So I will introduce him to Wampox, and we'll have a nice time getting to know each other. On the 6th, I spent several sessions with future leaders. Thank you, Commissioner Wolf, for spelling me at lunch so I could come over and do the Scott County Transportation Committee meeting with Commissioner Ulrich and others. On the 7th, I had breakfast with my friend Fred Corrigan to talk about 2 things that are of interest to the county. One is the watershed districts. He's leaving the Prior Lake, Spring Lake district, so that seat will be opening up, but is interested in what we're doing with the Lower Minnesota River Watershed District. There may be something happening there where we can use his talents and his passion by expanding Scott County's seat on that board, and also the housing discussion that's going to be held tomorrow afternoon, and I'll be attending that. On the 8th, I had breakfast with Lisa Fries with specialty soybean processing folks that were interested in whether there was land available along the railroad in Scott County to help open up new markets to Long Beach and Southern California. That, of course, be markets to Southeast Asia. Fascinating discussion, and just kind of underscores the fact that not only do we need to pay attention to our highways, we need to pay attention to the railroads and how they fit into the economic development package also, Commissioner. The 11th, with Commissioner Weckman Brecky, I say that carefully, attended the session priorities in St. Paul with the Shakopee Chamber of Commerce, and friends from other points in the county were sitting with us as well. It was a good time was had by all, good time of fellowship, and kind of hearing from the legislators and the governor. And on the 13th, the Shakopee Chamber had their monthly meeting. It was an overview. Twin Metals was there, talking about their 10-year process of developing a mining plan. And they've spent about $1 billion over 10 years just getting to the plan part, so now they can start the permitting process. They were, of course, making comments that Polymet, a similar concept with a different mining technique, is now in year 17 of its permitting process, and it's caught up in the Supreme Court because the appeals court threw out all the permits that they got and told the state agencies to do it again, which is really quite an astonishing development. That's the best word I can put on it. So we're all paying attention to what that means, because anybody doing any kind of industrial development or mineral extraction in this state is in for a long and expensive slog. One of the things that's primary in the Twin Metals project is copper. The projection with all of this stuff and electric cars and windmill motors and solar panels is the enormous consumption of copper. We will need more copper in the next 20 years than we've mined in the entire existence of mankind, just as the way things are going, which is one reason we're noticing expired and mothballed copper mines in New Mexico and Arizona are being reopened. And we have more copper on the Iron Range in that formation than all the copper that they have in the desert Southwest. And did I mention we're in year 10 of just the mining plan, and they haven't even started to pull the permits yet? It was an enlightening discussion, slightly maddening, but just for your edification, ponder those things. And on the 14th, I attended Scale. Mr. Chairman, that's my report.
Thank you very much for my report. On the 4th, I had my monthly administrator meeting. Thank you very much for the conversation. On the 5th, while on the road, I was able to call into the draft rules meeting that Commissioner Wolf, you were there for that one. This is for the watershed, where I think I mentioned, I don't know, a few weeks or a month back, that there was some disconnect from where the Prior Lake Spring Lake watershed wanted to be with some new rules and updates, and where some of the cities and other jurisdictions were. So this was the first, everyone had submitted their comments, but this was, I believe, the first meeting where everyone was able to stare eyeball to eyeball and kind of get some things out and some misunderstandings. So I think it was, from what I heard on the conference call, was a very good step in alleviating some issues and concerns, and then still some more things to chew on. And then on the 10th was the actual meeting when I was back in town for that, for the Prior Lake Spring Lake watershed, which most of that was closed session for a review of the administrator. So stay tuned on the draft rules. On the 12th, as was mentioned, Prior Lake Quarterly, spent a lot of time on an intersection. And then on the 15th, I attended the Polar Plunge, my first ever Polar Plunge, but I was behind the gate. But Scott County Sheriff Department was well represented, law enforcement was there, I think I saw Chief Sauer running around to go jump in. My daughter was taking part with high school athletics, not only in Prior Lake, but Shakopee was there, New Prague was there. There were some other teams. It was so I tried to do a little drone flying, but somebody beat me to it, so I don't have any good footage there. But maybe next time, maybe the county board needs to.
We should.
Be a good. It was a great day for it.
I will watch.
Someone's got to take the pictures, right? So with that concludes my report. So I will look down to my left. County Administrator update.
I just have one thing to add to Commissioner Ulrich's mention of the CDA group working on this. We'd recommended Brad Davis, Lisa Fries, and Steve Jones from our financial office. The three of them participate. So looking forward to them being part of that team. That's all I have.
Great, thank you. Looking to my right, County Attorney, any need to recess for?
Sure, we do not.
Nice, thank you very much. With that, item number 13, adjournment.
I'll move adjournment.
Second.
We've got a motion, we've got a second. Is there any discussion? I'm always looking to my left here.
Not today.
All right.
I'm hungry.
Let's put it to vote. All in favor? Aye?
Aye.
We are adjourned.